For those who have had back pain for a long time, it is basically difficult to pull up the fascia on their back. Is there anyone in our class who has had back pain for more than 3 years? I see that you have back pain. I see that you couldn't get out of bed when it was the most painful last year. Were your legs numb because of the pain? No? So when you're in bed, it's usually painful, and no matter how long you lie there, you just can't get up. Let me take a look at you. Looking at you, the fascia on the upper part here is relatively loose, but when you get to this area, it's still okay here, but once you get to this spot, it doesn't work anymore. Here, you can't pinch it up. You really have to use a lot of force, really pull hard like this to get it up. For normal fascia, look at mine. You can just pinch it anywhere at all. You can pinch it anywhere, yes, even the soles and arches of your feet, the scalp too, anywhere at all. As long as you can't pinch it up somewhere, it means the fascia in that area isn't sliding properly. This will affect fat metabolism throughout your training process, the transmission of force during exercise, joint stability, and your overall support. All of these issues can occur. Looking at his buffalo hump, his condition is actually not too bad. In more severe cases, I can't even pinch the skin at all. You can see that it's completely stuck together in one lump. No matter how you try to pinch it, you just can't lift it, right? It simply doesn't move at all. No matter how you try to pinch it, you just can't lift it up. When you pinch, it's just one solid lump. It's all fused together. So for members like this, if you want to reduce the fat in their buffalo hump, it's extremely difficult because this area is all stuck together. It has formed a kind of encirclement here. So while it will still reduce, it will do so much more slowly than in other areas. That's why for some people with a buffalo hump, after they lose weight, the hump actually looks even bigger because the rate at which this area reduces is slower than elsewhere. In this situation, you need to use manual techniques. What are the manual techniques for? It's not to squeeze the filling out of the lump. You can't squeeze it out. That's fat. Many people say that their buffalo hump got smaller after bloodletting. Well, it only looks smaller after bloodletting because the blood you draw out removes some of the moisture from inside the lump, but you can't actually remove the fat inside the lump through bloodletting. So after you finish drawing blood, once the moisture returns to the area, the lump goes back to how it was. All you did was relieve some pressure from the lump. You didn't actually reduce any fat. To sum it up for you, if someone truly has a buffalo hump, what is a real buffalo hump? If you look at it on an ultrasound, you'll see a big white mass inside. That's a real buffalo hump. For a real buffalo hump, no matter what technique you use, whether it's acupuncture, bloodletting, tuina, or massage, none of them can get rid of it. Why is that? Because it's fat. What's inside is fat. Any claim that a buffalo hump can be reduced immediately or noticeably shrunk after just one treatment is a scam. How could you possibly eliminate the fat in one go? That's impossible. The contents are still there, so at best you can only make it look smaller. If you just want it to look smaller, that's easy. I can simply increase the mobility of the thoracic vertebrae here, and it will appear smaller. If you spread out the clustered fat a bit and take a photo, it will look smaller. If you lift up the fascia here, shake it, loosen it, and speed up the water metabolism in this area, or it will look smaller. If you do acupuncture, let out some blood to relieve pressure. It will look smaller. This only makes it look smaller visually, but the fat tissue inside hasn't changed at all. Do you understand? Unless you undergo liposuction. Let me tell you, for people with a buffalo hump, if you have surgery to remove it or get liposuction, after the fat in this area is removed, there's a high chance you'll develop cervical spondylosis within the next 3 to 6 months. So what's the reason for this? Let me explain. Even though it's fat, it actually stretches out the fascia on the outside of your fat. The fascia along our entire back is continuous, and when it gets to this area, it's stretched open by the hump. The fascia then bypasses this lump to transmit force and control your cervical spine. Now let me tell you what kind of people are more likely to develop a buffalo hump. Actually, the underlying principle is quite similar to having fluid accumulation in a swollen knee joint. Our joints are very smart. You'll notice that women are more likely to have a buffalo hump than men. Why does this happen? It's because women naturally have less muscle strength than men. When the knee joint fills up with fluid, or when someone develops a buffalo hump here, it's often related to their physical constitution. When your body is unstable, it increases the internal pressure and fills the area with something. In other words, your muscles are no longer able to keep the joint stable. You don't do any training, yet you keep loosening me up every day, and you still make me walk and go up and down stairs. So I have to find a way to stabilize myself. If I were to grow bone spurs or have two bone spurs fused together, that would take a long time, and during that process, the damage could get even worse. So instead, I create inflammation, filling the joint capsule with fluid, or I make it bulge out. Once it bulges out, your fascia gets stretched tight, and then it can hold things in place better. That's how stability is achieved. Go ahead and check. Out of 10 people with a dowager's hump, about 8 of them have cervical instability. They rely on making that hump bigger and increasing the tension in their fascia to hold their neck in place. It holds up their head. So if you suddenly relieve the pressure here and remove the fat, in this situation, you can think of it as fascia that was originally stretched tight being released. As a result, after you remove it, there's a hollow inside and the inside becomes flat. So this fascia completely sags down, it's totally relaxed and has lost its elasticity. That means the mechanical force can no longer be transmitted here. It's disconnected both above and below. At this point, your cervical vertebrae, which you used to rely on for stability, now lose their last support as well. So it's very likely that a serious misalignment will occur. The herniation of the intervertebral disc is related to this connection. In fact, whenever there is muscle tension anywhere in our body, if you suddenly develop a lump here or suddenly there's a buildup of fluid there is always a reason for it. Except for external injuries most of the time, these natural reactions of our body are all forms of self-protection, including bone spurs. You've seen elderly people whose bones are fused. There's a bone spur from the upper vertebra and another from the lower, and then snap, the two fuse. This happens because stability is lost. Their multifidus and other supporting muscles can't hold things in place, so the body stabilizes itself by growing new bone to hold everything together, fixing the area this way. That way, I can live longer and hold out longer. If you don't understand the principle and just remove it for appearance, you might pay the price with your health. So for someone like him, what should you do? First, you need to get his thoracic spine moving, especially the thoracic vertebrae beneath the hump. Of course, there are many ways to get it moving. The least stable method is to directly perform manual adjustment on his chest, specifically at the T1, T2, T3, and T4 area. This is the least stable approach. Why is it the least stable? Because there's a reason why this area is locked and immobile. It's because this area is being pulled tight. And the reason it's being pulled is that the lower part can't push up. He doesn't have abdominal pressure. When he exhales, he can't fully breathe out. So the lower part doesn't exhale, and only the upper part does. That's why, even after you directly perform manual adjustment on the thoracic spine, his transverse thoracic muscle here remains tight, and the expiratory muscles below are still weak. He still has to use the transverse thoracic muscle to exhale. So after your adjustment, the vertebrae at the cervicothoracic junction quickly become locked and immobile again, which means you end up having to treat it frequently. The flexibility of the thoracic spine that you address can't be applied to breathing because it's disconnected. Only this section is being manipulated by your technique. So you must understand the reason why this vertebra is immobile. Then what do you do in the second step? The first step is to get the vertebra moving. The second step is to ensure the mechanical transmission of force through the fascia to allow it to glide smoothly. It needs to return to normal. You shouldn't let this area stay like this, where no matter how you pinch it, you just can't lift it up. That's why this buffalo hump is connected to the upper trapezius, causing the entire upper trapezius to always be very tense. I looked at his waist. Her waist isn't in good shape either. So for members like this, fat loss is the slowest and rebound is the fastest. It's actually quite difficult to help this kind of member lose fat. Let me ask, how many years have you been trying to lose weight? 10 years. During these 10 years, your husband has been in the military and not by your side. Let's shake hands. Do you have any complaints about that? During this whole process, I had to give birth by myself, and he wasn't around for any of it, nah. I held in a lot of resentment and had to bear a lot of grievances all on my own. Right? Exactly. That's why the degree of fascia adhesion throughout her body is way more severe than what you'd expect for her age. It's like the condition of the skin and fascia we see in clinical cases of people who are at least 50 or 60 years old, which shouldn't be the case here. There must be some other issue, and it's affecting her whole body, not just the dowager's hump. The adhesions are everywhere, so there has to be an underlying reason. Think about it. A woman whose husband hasn't been by her side for 10 years, not even there to support her during childbirth, no matter how great she is, no matter how strong a woman is, can she really not feel wronged? Right? It's fine, right? Everything is for the child. Her child is already over 6 years old. So in her case, a lot of the time, it's actually an emotional issue. When you can't let go of something emotionally, it manifests through your body, either as pain or as if someone has wrapped you from your feet to your neck in plastic wrap or cling film. So many people are actually living as if they're wrapped in cling film. Cling film has no elasticity, so you can think of it as their fascia turning into cling film. For clients like this, their pain issues can't simply be addressed with manual therapy because a lot of their pain isn't really about physical pain. They're just using pain as a way to express their emotions. They can't take it out on their family or their children, and if they're good at managing their emotions and don't want to pass their negative feelings onto their kids, then their own bodies end up bearing the burden. If she's someone who isn't good at managing her emotions, then her child will have a tough time because she'll take out her resentment toward her husband on the child. After all, the child is her own flesh and blood. That's why many children end up having a hard time, but I believe she's actually a good mother because she wraps herself up so tightly. All right, it's okay. These things can be improved gradually, so whenever you have time, just pinch and pull your fascia like this. Doing this while you practice will also help you slim down faster.